What's up, everyone? We got Steph in the house. Steph is one of our new trainers over at Beat Fitness, so you'll be seeing her in some of the more videos. But today we're going to go through, work on her neck, her mid-back, her lower back, her hips. We're going to do some muscle work up in her neck and her traps, her levator scap muscles, get her adjusted, and then teach her maybe one or two exercises at the end of the appointment, right? So Steph is a college and high school rower, correct?
Yeah.
And give a little demo of your row form, right?
So I was rowing starboard, so I'd come up between the knees, and then I'd come back straight, but there's a pivot out when you're coming up to the catch.
Cool.
So
lots of repetitive movement, right? Lots of repetitive movement in high school and college, always kind of reaching
One
to
side.
the left side and pulling, and left side and pulling, right? So now that she's working here, we're starting to get her educated on a little more lat tension and a little less neck tension, but really over in this left upper trap, left levator scap, she's got a lot of crunchy stuff here. So just like you've seen in some of the other videos, we're going to do some myofascial release up into her neck to help loosen up some of the muscles here. We're going to use the hypervolt a little bit on her neck. If you guys haven't felt a hypervolt, it's awesome. We use it on all of our patients nowadays, but it's a good little vibration tool or a little percussion tool to help kind of promote blood flow. All right, so let's start with the muscle work up in the neck, and we're going to go through. I'm going to pull this down a little bit. Look up straight for me, and down straight, and up and down. Okay, so up. So the way that you've seen in other videos, up, down. We do three things here in my clinic. 1, muscle work. 2, adjustments, and 3, we go through some different rehab exercises with all of our people. Up, down, up, and down. And really everybody, so many people have those tight upper shoulder muscles, those tight neck muscles. Up, down. Specifically the levator scap, the upper trap, the supraspinatus, the rotator, one of the rotator cuff muscles gets kind of like all balled up from posture, and Steph can feel right here through this shoulder. Lower that left shoulder now. Perfect. Look up and down and up and down and up and down. Okay, hold right there for me. Look up, down. So what muscle work helps to do, what this myofascial release helps to do, or this pin and stretch therapy, down, helps to do is break up tight fibrous adhesions throughout the muscle. It helps to promote circulation, up, down, up. And it's going to make her easier, it's going to make her body have a little easier time finding and activating her lat muscles. Look up, down, up, down. Good. Okay, relax there for me. Hold right there. And so, look up, down. I really like the hands-on technique, up, down. Kind of skin on skin, right on the muscle, right on the skin. This helps me to feel a lot of the fibrous adhesions or the little nodules, the little sticky spots in her connective tissue and musculature. Up, down, up, down, up, down, up, down. It really helps us to get deep down into that muscle belly to promote some circulation and improve that movement. Down, hold, move this right over, look up, look down, look up, and down. Okay, and I haven't worked on you for a while, right? But you can feel how both glenohumeral joints, they're good, they're moving, right? So that's a good thing to see, is that they're both loose right here. Okay, lean your head to the right and left and right and left and right and left and right and left, hold, and right and left and right and left, right? and right and left. Good. So these muscles, they get all kinds of like knotted up. They get really tight, right? And so many people end up with these like super duper tight shoulders, and everybody says, this is where I carry my tension at, right? And so here in our clinic, when you're a patient, one of the things that we try to help you to understand is that we want to carry your tension like down here in your lats. I'm gonna poke your lats, right? So her brain, we want to teach her brain how to be just a little bit stronger in the down and back maneuver, right? Just a little bit of tension, right? And the more that we train her brain to kind of feel this down and back, the easier it is for her to kind of hold herself down and back a little bit, right? You can kind of feel how that just turns off so much of your neck tension.
Right.
Cool. All right. So if you guys haven't seen the Hypervolt, awesome tool. That is a percussion device or a vibration device. Probably one of the top rehab massage tools out there on the market right now. And after we do some deep hands-on muscle work, we're just going to kind of just treat the area, the shoulder girdle complex. And what the vibration does, it helps to kind of shake everything up, promoting circulation, breaking up some of the tight muscle fibers. And if you guys have one of these, or if you have a healthcare practitioner that uses one, you might find some areas are very sore and other areas might not feel like anything, and other areas they actually might be ticklish, right? So no pain, no ticklish is a good healthy normal muscle. Pain or ticklish indicates there's some kind of dysfunction. Dysfunction means that that muscle can be too tight, too fibrotic, or that muscle might be too weak and it might need to be strengthened a little bit, right? So typically what I've found out is that a muscle that's ticklish or kind of sensitive needs to be strengthened, and a muscle that hurts generally needs to be released. So this vibration goes the whole way through the body, right? So it makes some people's nose ticklish or itchy. It makes some people's eyes jiggle a little bit, right? The better that the muscle and the joints and the cartilage and the connective tissue, the better that your body is at absorbing vibration, the less the vibration goes through your body, right? So the more absorbable your body is, the easier it can deal with stressors. And so we're going just right around the shoulder girdle. We did some myofascial release or muscle work right around this area too. Steph's been doing some of our rehab over at the gym, some of our lat activation. She's been doing some pulsing, some coiling, a little bit of the RMT rope work, which has helped her to find her lats, to find a little bit better core movement, a little bit better core activation, which translates into better spinal locomotion, easier adjustments, better body health overall. Cool. Let's go face down on the table for the evaluation.
We took the original photos.
Of your feet?
Yeah.
Yeah, nice.
Brian and I did it like 2 or 3 weeks ago. So I'll be interested to see. I've been working on some of this stuff.
Yep. Can I raise this up?
Yeah.
You've been trying to kind of just feel your stance, right?
Yeah. Not have lazy arches. That's what my friend told me. Yeah. She's a yogi. She's like, you're standing all lazy.
So Steph has some kind of flat feet, right? Some lazy arches, she just said. And so in a future video, we'll shoot a little video of her feet. We'll show you some rehab exercises that we want to work on with her to help improve the strength of her plantar fascia, posterior tibialis, all the important foot muscles. But today's video, we're just going to go through this spine adjustment, full spine adjustment. She can feel right through the lower back. A little bit of inflammation, not bad though, right?
It's better than it's been.
Better than it's been. Feel right here is your bad guy.
Yep.
Even right here.
That's the one that gives me the most.
So, Steph has a tattoo down here. She still is a rowing coach, right? But she's got this nice oar tattoo. And funny thing about tattoos is that they cause tissue trauma, right? So if any of you guys have tattoos, if you remember how that tattoo felt, it was kind of like sharp and it was kind of like jarring to the skin. And tattoos, when you get a tattoo, it's a form of tissue trauma. So it can actually cause long-term damage, muscle inflammation, tissue swelling, even vertebral and joint misalignments, irritations, restrictions. So right up her spine, in her lumbar spine, she's got a little bit of inflammation right here. And right where the head of the oar is, right here, feel that thing right in there?
Hurts.
Hurts, right? She says it hurts. So right over this head of the oar right here. Blade of the oar, excuse me. Right over the blade of the oar is where she's got some of her vertebral irritation, the supraspinous ligament that covers the spinous processes, and then the erector muscles right in that general area. They're a little tighter than what they should be. They're a little rough. They're a little bumpy. I'm kind of using my knuckles to get right down against her, right into her spinal erector muscles. And this is a great therapy to really help loosen up some of the musculature around the lumbar spine, ultimately making her vertebrae adjust a little bit easier, which is going to directly translate into improved range of motion, improved circulation, reduced swelling, reduced inflammation in her lower back. Okay? Bend up here. We're going to raise this leg up. Just relax for me. Push knee down to table and stop and push, stop, push, stop, push, stop, push, stop. Good. Okay, we're going to raise this right leg up. Push knee down. Stop. Push. Stop. Two more. Push. Stop. Push. And stop. Good. All right, man, let's get into it, right? Okay, so we're going to start with thoracic spine, arms down. All right? Real quick with the spine adjustments, what we're checking for is any kind of rotational or lateral flexion, irregularity of the spine. She feels right in the left shoulder here, a little bit up higher in the right mid-back right here. We're just feeling her little vertebrae that basically they get a little kind of like twisted, right? So the old saying was like, oh, you've got a bone out of place. Well, bones don't really move out of place. Muscles pull bones in different positions, right? So if you've ever seen somebody when they're older, they kind of walk around maybe all crooked. Sometimes people have high shoulders. That's due to muscle imbalance and ultimately structural imbalance in between the individual vertebrae, which are the little bones in your spine. Could be due to your shoulder girdle being a little crooked. But Steph has a little bit high up in the right, the mid-left right here, and a little bit in the mid-left side. A little more in the mid-left side, right where that blade of the oar is. And over on the right side, and then her right hip is, or left hip, excuse me, is just a little pulled backward, right? So we're going to go through, we're going to adjust each of these different segments. All right, we're going to do that thoracic spine first. Take a deep breath in. Exhale out. We're going to add a little torque right into here. Good. Breath in. Breath out. Whole way out. Good. Breath in. Exhale, whole way out. Good. Breath in. Exhale, whole way out. Whole way out. All right. That was a little deep one. Okay. Okay, right here. One more here. Good. Okay, we're moving today, man. Okay, face me over here, left side up for me. And we're going to straighten here. Bottom leg, you're good. Boom. Okay, we're going to do lumbar spine. and left SI joint. I'm going to put my hand right here, okay? Deep inhale. Exhale out. Good. Good. Other side for me. So we got to get that left SI joint still. It's a little tight on the left side. Here. Here. Look up. Deep breath in. Exhale out. Whole way out. Good. Flat on your back. That's the good side. So a little tight on that left side. We're going to give her some vibration work to do out over on the Vibe machine. Bend your knees for me. Both up. Squeeze together for me. Good. Relax down. Put this hand down here. Both hands down. Actually, hip feels pretty good. A little tight right through there. Let's compare that. Bend here.
This one feels not bad.
Not bad, right? Kind of smooth through here, right?
Yeah.
Feel how smooth?
Yeah.
Bend here again. So I feel how that, it's smooth too, but there's a little more tension right there. Push into my hand for me.
This way?
And stop. Yep. And push. And stop. And push. And stop. And push. And stop. Awesome. Okay. Time for neck. Neck, neck, neck. Okay. Shoulder's going to be down. And then you feel, so if you guys have never been to a chiropractor, never had your neck assessed, you know, right off the bat, we can feel her right side of her neck's all swollen and jammed up. And then a little bit on the left side. So we're going to do left first, shoulders down. Good. And over here on the right, shoulder down on the right. Good. All right, buddy. Okay, a little stretch with the arm here.
Ooh.
And most people, if you haven't been to a chiropractor, if you haven't been worked on before, you can hurt your neck. You can injure it when you're a little kid, when you're 1 week old, when you're 1 month old, when you're 1 year old. And when you're 10 years old, you can hurt your neck. You can hurt your neck at any time throughout your life. You can hurt any part of your body at any time throughout your life. And a little joint, a little bone, a little muscle, it can kind of get just a little crooked or a little strained, and that can influence how you move your entire life. You can have maybe like a twisted neck muscle, which causes your head to be a little tilted, and that can cause your whole body to shift the entire way down to your feet, right? And so what chiropractors do, and even some physical therapists nowadays, when we work on treating the skeleton, we help to loosen up the bones and improve the movement in between the joints of the body, which ultimately helps you to bend and twist and be able to move a little easier, right? Okay, good. Sit up straight for me. Spin to the left. And bend here. Relax that right. Good. And one more here. Good. All right, man. And what that was, you heard that little posterior capsule of the glenohumeral joint. Little adjustment to help break free any fibrotic scar tissue, any tightness, any tension in the shoulder joints, helping to promote blood flow back into the cartilage of the glenohumeral joint. We adjusted Steph's neck, CT junction, mid-back, lumbar spine, both of her shoulders, a little bit of her hands and fingers today, so we got her kind of loose and feeling good. That's it for today, right? So that's her typical neck, mid-back, low back appointment. You guys have seen some other videos like this. We'll throw some compilation videos with some neck adjustments. She had a good neck adjustment today, and we'll see you guys on future videos.